If you have dry, peely skin at the bottom of your foot that you can't get rid of, there is a good chance it could be athlete's foot. I'm going to show you what that looks like. And also in this video, I'm going to give you 4 steps on how to resolve athlete's foot at home, including natural home remedies. So stick with me. Hey everybody, it's Dr. Gaffney, saving you time and money in your foot care decisions. So athlete's foot is caused by a fungus, and the fungus likes to eat the protein called keratin in your dead skin layer of your foot. And fungus is everywhere. It likes a dark, moist place like your shoe. And normally fungus and bacteria, they're all over your skin, and they usually live in harmony with your skin and don't cause any problems unless there's certain conditions that cause them to produce in numbers that can cause problems, like athlete's foot. For instance, if your feet sweat a lot or you're in boots all day long working like a construction worker or a highway worker, this will give the fungus an environment, the hot, sweaty environment that it loves, and it'll start to multiply and infect that dead skin layer on the foot. Athletes, of course, have this problem, hence the name, but you don't have to be an athlete to have athlete's foot. In fact, I'd venture to guess that most people with athlete's foot are not athletes. So some people have certain genetics that makes them prone to develop athlete's foot. Diabetics can be prone to athlete's foot, especially when it's caused by yeast or candida. So the most common type of athlete's foot is this dry, chronic, recurrent type athlete's foot, where it's dry and peely looking at the bottom of the foot. So it'll go sometimes in between the toes and up the sides and back at the heels. So, and typically with chronic athlete's foot, there's usually no symptoms. It doesn't itch. Kind of the telltale sign of this rash is that there's little tiny circular scales all over, and it's really well defined. It looks like a little moccasin on the bottom of the foot. We call that tinea pedis, or athlete's foot, and moccasin distribution. That's how we talk about it when we chart. But if it's an acute type of athlete's foot, there's certain types of fungus that cause an acute type of athlete's foot. And this is the type that it comes on very strong, and you get little tiny blisters and it itches real bad and burns. And that's more of an acute type of athlete's foot. So it's important to treat athlete's foot, especially in patients that are diabetic and those with poor circulation, because it can cause cracks in the skin, and that lets bacteria come in and you can get secondary infections from that. Also, athlete's foot can resemble other types of rashes and skin conditions, so it's important to get diagnosed by your doctor. So the fungus that causes athlete's foot is the same fungus that causes toenail fungus, but unlike toenail fungus, athlete's foot's a lot easier to treat. Toenail fungus is extremely difficult to get rid of. But with everything, there's outliers, so it might be difficult to treat chronic recurrent athlete's foot, so it's important to treat it properly and to prevent recurrence after it's treated. Okay, so now our 4 steps to treat and get rid of athlete's foot at home. So the first step is good hygiene. So washing and drying the feet every day, especially washing and drying well between the toes, keeping your toenails trimmed, wearing clean socks every day that are moisture wicking. So moisture wicking like a drymax, Coolmax, or merino wool types of fiber in the sock. You want to avoid high percentage cotton fiber in the sock. Cotton blend is normal with most socks, but as you get to 100% cotton, what happens is that the cotton will absorb all the moisture if you sweat a lot, and then it'll keep it right up against your skin, which is not good. Please see my video on how to resolve sweaty, smelly feet, because I go into the different socks and how to resolve sweaty feet. So the other thing you want to avoid is occlusive footwear, like occlusive uppers like leather or vinyl that'll hold the heat and the moisture in, and try to find a shoe with a mesh upper that's breathable, and maybe wear sandals and air your feet out every day. If you do have chronic recurrent athlete's foot, you might want to invest in a UV sanitizer. I'll have the link in the description where you can find that. So the UV light will kill the fungus, or you can let your shoes just air out in the sun, might do the same thing. So you might want to consider throwing out your shoes if they do have an odor in them, because it'll hold the fungus and serve as a source of reinfection. All right, the second step, you want to control any sweating of your foot, because that moisture also will cause the fungus to thrive and grow. So there are many antiperspirants over the counter that work very well, such as Certain Dry. And again, in that video I referenced before, I list all the different types of antiperspirants that you can get. You can also use underarm antiperspirant on your feet to help control the foot sweating. Soaking in vinegar will help reduce the fungus on your feet as well as control the foot sweating at the same time. So what you have for the vinegar soaks, you get 1 cup of white vinegar or apple cider vinegar, and it's one part vinegar to 2 parts water. So if you use 1 cup of vinegar, use 2 parts water, and you soak for 20 minutes, about 3 to 7 times a week for 4 weeks. Okay, the third step is getting rid of any dead loose skin on the bottom of the foot. So after you're done soaking in the vinegar, or you can even soak in Epsom salt, I tell my patients to get a loofah sponge and just gently rub away that dead skin. You don't want to pull and peel it off, because then you'll get a wound and that'll hurt real bad. And if there's a lot of dead skin, you can purchase like 20% urea cream, and that'll cut down on it. And I'll have a link in the description for that. So that reduces the callus, and so that'll remove that keratin, or the food for the fungus, so essentially starves the fungus. So it's a good adjunctive treatment. Another thing that can be done if you're soaking in Epsom salt is getting tea tree essential oil, and tea tree oil is a known very potent antifungal. So you can put, I'd say, like maybe 5 to 10 drops in the soak and do your soak, and that should accentuate the effects. The other thing I wanted to add, if you're purchasing essential oils, make sure you purchase from a trustworthy company that has been known for good quality and purity, and it prevents dilution of the oil and prevents harmful additives. I use Young Living, and I trust them. And I'll have a link to that tea tree oil in the show notes. I would not recommend buying essential oils off Amazon, because the quality can't be trusted there. Okay, the fourth step is using over-the-counter topical antifungals. The over-the-counter treatments for athlete's foot work very well. It's rare that you need a prescription to resolve an athlete's foot. I prefer a fungicidal type of over-the-counter antifungal topical, because it will kill the fungus. There are 2 of them over the counter that do this. It's Lamisil and Lotrimin Ultra. Be careful buying Lotrimin products, because not all Lotrimin products have the fungicidal component of the butenofine. The other Lotrimin products over the counter have what's called clotrimazole in it, and that's fungistatic. And fungistatic means it just inhibits the fungus, it doesn't kill it. So I prefer my patients use over-the-counter products that kill the fungus. And only the Lotrimin Ultra has that butenofine component in it that kills the fungus. And Lamisil, again, is also fungicidal and kills the fungus as well. So yeah, if you have a dry variety of athlete's foot, so that dry peely type, it's probably best to get like a cream. And if you have a more moist type of athlete's foot, or blistery type, you want to get a powder spray or gel. And when you use these products, but just be sure to put it all over the foot, in between the toes, on top, all over, up, up to the ankle. Sometimes the athlete's foot goes up the ankle, so put it up there, even the good skins. So with these over-the-counter fungicidal products, the Lamisil and the Lotrimin Ultra, it has on the package insert just to use for a week, but because it takes skin about 30 days to regenerate and turn over, it's probably best to use it for a month to prevent that chronic recurrent athlete's foot. You also want to use it as directed so you don't get resistant fungus or recurrent athlete's foot. So in the case of the Lamisil, that's twice a day. And a lot of people don't get it on twice a day, they get it on once a day. And that'll create a resistant fungus and it'll be difficult to treat in the future. So if you're doing all that I just talked about and you still have the athlete's foot, or if it's coming back, number one, it might need to be reevaluated by your doctor. It might not be athlete's foot. And number two, you may require a prescription to treat it, either a pill by mouth or a prescription topical. Sometimes diabetics have a hard time resolving athlete's foot, and as well as people that have fungal toenails, because people with fungal toenails, the fungus is in their nails and it serves as a source of fungus for the athlete's foot. So to prevent recurrence, just follow those first 1 to 2, maybe 3 steps that we talked about. As always, consult with your doctor before trying any new treatments and to get the proper diagnosis. So if this has helped you, please leave me any comments. I really appreciate you watching. Please like and subscribe. I appreciate that very much. And we'll see you again next time. Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.